This is Brandy Brimhall with Chiropractic Compliance Solutions, and I'm here with another HIPAA practice scenario for you. Again, this particular practice scenario doesn't include all of the details that you would have in a HIPAA compliance policy, but this is something that you should review for your practice to make sure that you have the particular policy and procedure in place that would apply to this type of scenario. So let's begin and review this scenario. The doctor frequently completes his patient documentation on an office laptop computer. Instead of using EHR software for patient notes, he prefers to type out notes in Microsoft Word using his own documentation template. This morning, before the office opened, the doctor was sitting at a local coffee shop completing yesterday's treatment notes while having his morning coffee. He briefly left his table, and when he returned, his laptop was gone. What is the potential impact, and how do you handle this particular scenario? Now, as we move on, some of you may be thinking this doesn't apply to us, so we don't need to do this, but I want to point out and make just one slight alteration for those of you that think this scenario may not apply to you. If your practice uses EHR and you find that this scenario is presented on the previous slide doesn't apply to your office, as I mentioned, consider the following as you continue to work through this scenario and apply the upcoming bullet points that we'll review on the upcoming slides as it pertains specifically to your practice. Is your EHR on laptops and tablets and other portable devices? If you have EHR on laptop, tablets, and other portable devices, continue going through all of these bullet points and review your scenario or this scenario as though this is your practice using the EHR software. So there are many ways that this particular scenario could apply to an office, and you should evaluate each of these bullet points just to make sure that you have adequate policies in place to detect, prevent, and mitigate issues. So now's a good time to pause and discuss this with your team. Make sure that you review your existing policies and procedures to determine if they help you to appropriately prevent and address this particular scenario. And once you're finished discussing that, we can go on and review some tips and strategies that I have for you and other things to consider. So now let's move on and consider some of these following possibilities. Consider how many patient notes are stored on this laptop. Consider what type of patient detail and protected health information may be included in these notes. Is your laptop password protected? Are the individual notes password protected? Or in the case of having EHR, how secure is your EHR and is that password protected? How is this protected documentation stored? Is it on a desktop, a hard drive, or some other method? And how easily could it be obtained? If the doctor does send these notes on that are from the Word document to a more secure location after completing them, does he remove the notes from his system? And if so, is the trash emptied? And if yes, also, what method of transmission is used for sending these notes to a more secure system? And is this encrypted? So you want to consider all possibilities of where a breach could occur or there may be inappropriate access to these patient records. You should also consider if the coffee shop has security cameras that may be reviewed to help retrieve the stolen laptop. In reviewing your policies and procedures, you should make note of if your policies and procedures are in place to determine the level of a breach that has occurred and how you must respond to the breach. This could include notifying appropriate patients, notifying the media, and notifying Health and Human Services. So these are all things that we should know and be able to promptly respond to and appropriately respond to based upon the level of breach. You also want to consider, is there a backup for this stolen data, or is your billing and collections now impacted by this as well? What policies and procedures and any other steps must be implemented now to minimize the risk or prevent this incident in the future? A few tips that I have for you here as you consider all of those bullet points. Make sure that you understand that there is no one-size-fits-all program. It's impossible to predict and anticipate every type of possible incident, which is why having HIPAA policies and procedures in place help to guide us and provide the framework that we need in order to properly detect, report, mitigate, and implement steps for future prevention of incidents that could occur or incidents that do occur. So your policies and procedures should define workforce member guidelines as well as responsibilities, and this includes the doctors and the protocol that's in place to best address varying types of scenarios. So now's the time again to pause and discuss as you've reviewed those bullet points to determine what improvements or changes may be necessary for your HIPAA policies and procedures? And do you have other questions that need to be addressed or other possible scenarios that could happen or have happened in your office that should be reviewed as well? This is a good time, and these types of scenarios also are great for opening discussion within the practice of other things that might occur in regards to inappropriate access, use, or disclosure or breach of protected health information. And in closing, once we've reviewed this scenario, if you've determined that your HIPAA program that's currently in place really could use a facelift and you need more information to build better HIPAA policies and procedures, there's a HIPAA compliance training program for you available. It's online and comes with many benefits and features that you'll be interested in learning about. A couple of things I want to share with you is there is a HIPAA-only training program that does cover all of the required components of HIPAA security and HIPAA privacy, including the HIPAA security risk assessment. And this is going to be helpful for practices that either don't have any HIPAA implementation at all in their practice, or for practices that have some or all of HIPAA implemented but need to review it and possibly make updates, which is, by the way, required a minimum of once per year. Now, because this is HIPAA-only training for those practices that really have found that they need to go through comprehensive compliance, because compliance, as we know, is much, much more broad than just HIPAA only. There's also an online compliance training available, so your practice should review the options and benefits of both of those to make sure that you know which one of those is going to be best suited for your practice. Again, you can visit compliantchiro.com for that particular information. And there's also a help desk, so once you've reviewed about those services, if you have questions about how those work, certainly submit those to the Compliant Chiro help desk and someone will reach out to you promptly.